Welcome back to the New South Wales Government's Business Connect webcasts on business disruption. My name is Steve Waite. I'm a Business Connect advisor and CEO of the Business Centre. Business Connect is a dedicated and personalised New South Wales Government program that provides trusted advice to help you start, run, adapt or grow your small business, and is delivered through a network of independent service providers across New South Wales. If you would like a business advisory session subsidised by the New South Wales Government under the Business Connect program, call 1300 134 359 or email connect@treasury.nsw.gov.au. So today's webcast topic is public health orders and your small business. We're looking at them again and how we get ourselves in a place to implement them as they have come into effect and what we need to do to have front of mind to ensure we operate our businesses how we want them to run, that works for us and is in accordance with the public health orders as set out along the New South Wales Government's roadmap for easing restrictions. We have again with us webcast panel of speakers with the smarts to interpret the latest information and share their expertise and provide practical insights for us only in the days now where we're implementing the new arrangements under the health orders. So on behalf of the Business Centre and the Business Connect program, I would like to introduce our expert panellists for the webcast. Christie Howson, owner of Osborn Law. Christie is a solicitor, director at Osborn Law, practising in areas of employment law and commercial litigation. Osborn Law is a commercial employment and property law firm situated in Newcastle CBD that provides a practical legal approach to clients with timely, sound, cost-effective and straightforward advice. By way of background, Christie has combined law and commerce degrees from the University of Newcastle with experience in corporate, commercial law and insurance and in multidisciplinary practices, primarily practising in the areas of employment law and commercial litigation. Next we have Antony Cruz, Regional Engagement Manager for Service New South Wales. Antony joined Service New South Wales in 2016, the newly created Making Business Easier project team, and is responsible for setting up the now successful Business Concierge service within Service New South Wales. Prior to joining Service New South Wales, Antony worked in investment banking and wealth management sector for several years in Sydney. Next we have Diane Loong, Managing Director at Skildare. Diane is a passionate and pragmatic human resource specialist with a strong commitment and proven track record of contributing to the growth and leadership of her clients' organisations. Diane has gained broad management and commercial experience with a demonstrated ability to work at the most senior level. She's a clear thinker and can focus strategically and laterally to provide the best outcomes for her clients. As a Managing Director and co-founder of Skildare, a human resource consultancy which provides fully resourced HR services, Diane has got decades of corporate experience in HR and specialises in the SME market. As an HR leader, she is driven to provide smart, pragmatic HR solutions with close attention to employee experience and mitigation of risk for employers. Now, for our key topics and the panel and what they're here to do is to focus on these. We're going to have three areas on interpreting the public health orders as business owners and how they've fallen that are not vaccine related will be our first area of focus. Then what specifically are the must-dos for us as small business owners in regard to the public health orders. And then lastly, we'll focus in around what we need to do to manage customer entry around vaccines and non-vaccine, QR codes, vaccine status, credentials, medical exemptions, all of those things that have come to fruition now that the public health orders have been issued and we're working towards them. We must meet these public health orders. They are a requirement of the government. Since our last webcast, there have been around 10 or 13 amendments, and these are moving in areas such as preventing movement around certain conditions, entering or leaving Greater Sydney, enabling the Chief Health Officer to identify stay-at-home areas by a notice published on the New South Wales website, allowing certain employees and others and workers to reside outside Greater Sydney to work on premises outside of Sydney if they have one dose in regional areas, allowing indoor swimming pools to be used in general area for certain purposes, allowing up to 10 persons to visit places of residence and holiday homes in the general area as it's defined, including additional premises in the general area in which unvaccinated adults must not be present, enabling up to 100 persons to attend significant events in the general area, enabling up to 30 persons to attend certain outdoor public gatherings in the general area. And there are a few other areas subject to amendment and further details which the panel will have further insight and knowledge of, I'm sure. As with our last conversation, I've reconfirmed with our panel that the answers they give are focused around reality of us still living with COVID for some time yet, and that our bottom line, all of us, is that ultimately none of us want to have a transmission event in our business or in our organisation. So to the first question, and we'll start with Christie again, but this question is around, we're now able to reopen. We're a little bit more familiar with the public health orders. We know we've got some amendments that have happened, but we're now at this implementation part of the public health order, particularly around vaccination. So what issues have arisen, and what practical steps can we now take now that we know a little bit more to make sure we don't break the law and we keep running our businesses successfully? So, Christie, first to you. Since last week, we're now here again. It's still the same, but it's a little bit different. So what are your insights initially?
Thanks, Steve, and thanks for letting me be a part of this again this evening. So I think, obviously, we had a good talk last week about the public health order, which was slightly amended on Thursday morning's announcement and was confirmed in writing on Friday. Since that time, businesses have reopened. It's been nice to go to the shops and see premises and open and people buzzing around again. It's nice to just see businesses up and running again. I think the main thing that business owners really need to do at the moment is to have a really good understanding of their particular industry, their premises, and where they fit in relation to the system. And we were just discussing really the options, I guess, where businesses can slot in. So we have some that are in those prescribed areas which have their own mandated public health orders around aged care and around nurses and around teaching, those sorts of positions. We then have the general COVID order, which became effective as of the 11th of October, and that has special rules for what we will call sort of higher risk industries, and that's including your hospitality and your retail and the like. We then have rules, I guess, for everybody else. Okay, and the public health order does cover everybody else. So everybody, your business and all of our movements are going to be subject to this public health order, but you really need to have an understanding of where your business fits in and what rules will apply to that. Those rules will relate to vaccinations, but they're also going to relate to employee numbers on the premises as well. So that, I think that the first real thing that businesses really need to understand is where do we fit in the public health order and what does that mean for our particular business.
So you're highlighting for us, first of all, be really clear about where you sit in regards to your categorisation of what industry you are in, and then thereafter how that applies with regard to square metres and densities. Is that the sort of thinking people need to do first up? They really need to define where they sit.
You need to work out where you sit and which employees you can have at work, which customers you can have on your premises, because all of that is going to be determined by where you fit in that public health order.
Okay, so we were talking earlier as well, and we've had a question come through earlier about, for example, a domestic cleaner or a tradesperson coming to your site, whether it be a business or whether it be a home, but specifically on this question, they're coming to your home to offer a domestic service in your home. What are the requirements around that and mask wearing and just common sense prevailing? What do people need to do?
Yeah, well, look, I still think that trades or anybody coming into the home should be wearing masks. There's no obligation on the homeowners to wear masks, but we were just talking before, Di, about having the conversation. What were your views on that?
I absolutely agree. I think particularly if the residents are doubly vaxxed as well. I mean, that certainly, visitors are allowed into their home if they're vaccinated as well.
That's right.
And if the residents are doubly vaccinated, then they're meeting a certain criteria there, aren't they?
That's right.
But if a cleaner, for example, is going into somebody's home, I think it's a conversation, isn't it?
Yes.
It's the owners of that house may prefer their cleaner, for example, to wear a mask while working, or might be ambivalent. So I think it's really, or the cleaner might require.
That's right.
Around the people around them to wear a mask. So I think it's really about keeping it real and having a conversation.
Yep.
Everyone is very different. Everyone has different needs and different opinions, and so I think it's really important. It goes to extends to everyone, isn't it?
That's right.
About having the conversation.
So another area, I guess, for people that have got businesses where they might be sending staff out to work now, moving around more freely. What about when they're in the vehicle together? What are the differences, or what are the things people need to be aware of with regards to wearing a mask or being in a vehicle with someone for a work purpose?
Well, I think that they're still required to wear those masks, and if you're sending your employees to premises and they're required to be in a vehicle or they're required to be obviously at other people's premises, you're still under an obligation as the employer to provide a safe working environment. So businesses really need to be consulting with their workforce and getting a good understanding of what risks there are by sending those clients out to those particular businesses and making sure that they're putting risk minimisation strategies into those premises, into those employees.
And the same household rules apply there. So if you're in a business together and you're in the car together, there's no need for a mask because you're considered to be from the same household.
That's right. That's right.
All right.
A lot of that will be relaxed though when we get to 80%, because at the moment, once 80% is reached, I think that there is going to be a relaxation of mask wearing, particularly in offices.
That's correct.
There will be some mask wearing that is still required in particular industries, and that could change again. But noting that we're getting very close to that date, and I think too, Steve, if people aren't sure, it's always better to be safe. And if you've got your mask and you're unsure, put it on.
Right. I'm just noting here in the roadmap provided by the state government, they talk to masks would no longer be required. It's the same as it is for 70% for outdoor settings, except for front of house staff would still prevail. Masks required for all staff and customers indoor settings, including public transport, planes, airports, except for children under 12. Okay. All right. Anything further to add in your observations from the amendments or the now implementation of the public health order? I mean, we've so far, and it's only been a few days, we haven't had too many hiccups with clients, giving a lot of hitting a lot of roadblocks so far. There's still a lot of questions, and there's a lot of things to still work through in relation to making sure their workplaces are safe and they've got the proper protocols in place, and that they are transitioning employees back in a manner that is balanced and meaningful and appropriate for their workforce. But other than that, I think people are slowly getting their head around the requirements. Particularly vaccination has, without question, being the most contentious issue and the one that's been most difficult to navigate, of course. But now that it's reasonably clear, if I can say that, now it's getting into the nuts and bolts, I guess, and protecting workers now that they are slowly coming back to work.
That's right. There's definitely definitely the vibe that I'm getting from my clients is that people are coming back to the office.
Yes.
So
it's a transition, though, isn't it, Christie?
Oh, yes. It's certainly not everybody in the office at once, but certainly clients of mine are indicating how do we get these people back to work, and it's really now the issue, as you say, transitioning back.
Now, we're about to move on to the second question, which is into the must-dos. For those most businesses that registered a COVID-safe plan and therefore then were issued a specific geographic sort of identity, we've been asked to go back, Antony, and revisit those COVID-safe plans now. What's the process there?
Absolutely, and I think, Steve, thanks for having me back. The most important thing is to revisit the plan. As I said, the things have changed and they are changing. And also for the previous topic, businesses should always make sure that they are up to date with the latest changes. And one of those changes will be the COVID safety plan. Just make sure that the requirements are there. And again, if you do not have those stickers, or if they're actually gone or lost or whatever, make sure you download them. Once you have your email from Service New South Wales, you can actually request for further collateral that you may need to put up in your business, but your COVID safety plan has to be rechecked to make sure you're up to date and current with the latest requirements.
Yep, and I note, and I'll just show for the benefit that as we spoke last week, it's now been quickly put into action. All of the signage that we've had for the last 20 months provided to us to help with entry and QR codes has now been further strengthened with a set of posters that we can use with regards to vaccination status and just stating an expectation at your site that it's a condition of entry. So wonderful to see those resources added to the toolkit. So coming back to we've got just a quick question that's come up, and we've added a lot of material to the links as we go, but a question that came up was kitchen staff and not customer facing, do they need to wear masks? We've added a link into the chat where people can get the answer to that right away to save us going any further unless someone wants to add something. Okay, so looking then, what specifically the must-do? So we've begun to touch on that a little bit. Must-do for employees and small business owners to act in accordance. One that you spoke to earlier, Christie, was with regards to customers versus employees in the one vaccination scenario, if you recall.
Oh yes, we were talking about that.
I think it's just really important. I mean, we did towards the end of our webinar last week. You know, there was talk that that a person with one vaccination could come back to work outside of the Greater Sydney area, could be permitted to work. I think it was just really, we were talking about it. It's really important to understand that outside of that Greater Sydney area and the regional areas where employees who have one vaccination are allowed to come back to work, but only for the purposes of work. That does. We just want to make the distinction that does not mean that a customer with only one vaccination is allowed into a cafe or into a restaurant or into a bar or a pub.
Yes.
The employee can for the purposes of work.
Yeah.
But not a customer or a client. It's just really important, you know.
Yes, for the distinction. So it's really about entry onto premises and those high-risk premises.
Yes.
Right.
So what it has said is that they're not allowed. Well, the original order was you're not allowed on the premises if you haven't had a double vaccination. It was then relaxed to say, if you're on the premises for the purpose of work, you can be there with only one vaccination.
Yeah. Yeah.
Yes.
Yeah.
Now,
so
But not to drink or eat.
No, that's right.
Yeah, I was reading the detail though. So for a lot of small businesses that have got young people under 16 working for them, they can be working.
That's right.
And they don't need to have vaccination.
That's correct.
Correct.
Yes, so that's a distinction that's important when you've got young people working for you. What have you been doing with some of your clients to help them with some of these must-dos? What advice are you giving them so that they're now ready to go? We're in the implementation phase. What sort of things have you been helping people with?
We've been providing a checklist. I've actually got one on my lap here where we've been providing checklists to our clients just to help them navigate, because there's so much information, right? And there's so many areas that they need to consider. Vaccines is obviously one area, but there's the safety plan that Antony alluded to, which is a huge part of getting people back to work. But we've got privacy policies. There's a number of policies, work health and safety, COVID policies, privacy policies that need to be looked at as well. Recruitment. So it's protocols around recruitment and the needs of recruitment. I've got a whole list here. There's areas for training that need to be looked at around providing safe workplaces, etc. Job design, so making sure the position descriptions have got inherent requirements of the job, so we can then determine, particularly if we're considering mandating certain positions within our workforces, it's making sure that our position descriptions are clear, so we can justify why maybe some roles require vaccinations as opposed to others. So we're providing these checklists to our clients to ensure it just helps them then tick the box to know that the areas that really need to be looked at are actually being looked at.
And Christie, you also advised, I know, and shared with us talking about vaccinations as we move towards that question in a quite prescriptive way. Go through all of the aspects of that you need to consider when you're consulting and talking to your staff about how you've established your position.
That's exactly right. So as a business owner, you may have a particular view about things, but at the end of the day, there is a requirement on the business owner under work health and safety obligations to consult with the workforce, and you really need to have those conversations.
Absolutely.
Okay, Antony, we might get you to give us a bit of an update as we head now towards our key area, I guess, is to look at this whole point of entry around vaccine, QR codes, credentials, exemptions, and how we might manage that best. But are you able to give us a little bit of an update with regards to the trial of the embedded vaccine status in the New South Wales app, or anything else further that you could help us with?
I can just give an update as to let everyone know that the trial is happening as we speak. We're going to pick 4 different LGIs with up to a maximum of 500 people for the trial. And so far the news is that it is working very well. And hopefully from Monday we should get that rolled out. Again, I'm just saying hopefully, provided there's no hiccups. But we do have access to the federal government data now, which was the main stopper for the whole process, but that's available now. And so that is the fourth option that business customers will have in terms of wanting to access any premises or businesses. So, but in the meantime, businesses should just make sure that they have the federal government certification, or they have the wallet. If you have a smartphone, that iPhone and Samsung, I believe, or the Google, you can use that as in the wallet, or you can even print a digital or a hard copy of the certificate and carry that with you, or make sure that the people or customers do have that. So, in terms of Service New South Wales, I'm kind of expecting that to be rolled out early next week.
Okay, and that's going to be all set out, as we know, with regards to evidence, sample evidence of the types of identification or proof of vaccination or medical exemption, which takes me, Christie, to you. Can you just take us a little bit through the medical exemption process again to refresh us and what it is? Because one of the ones that came up that we spoke of, which would probably fall under that, but is one that might come up, is where someone, whether it be an employee or a person, a customer, may have already had COVID, and what would be their status from a health perspective with regards to vaccination, because there's possible some exclusion time.
Yes.
So what are the rules? How do they apply
Certainly.
for, maybe we can talk a little bit more about medical exemptions and come back to proof of vaccination.
Yes. So medical exemptions, there's an approved form that the Chief Medical Officer has commenced, and all GPs need to obviously fill in this particular form. My understanding is it then goes to a panel to review that. Right. I have not seen a form yet. I have not seen a successful form. I've not seen one completed. I've seen the blank form. There are two options in the form. One is that if somebody has a complete contraindication to the vaccine. There's another one that provides that a person cannot be vaccinated for a certain period of time, okay? Yeah. So that, Steve, may be what you were talking about before when you mentioned that if someone did have COVID, I know there are recommendations to not have the vaccination for a certain period of time. So that person would be entitled to get the medical certificate, but they would have to go through that process. And my understanding is it's not a matter of going to your doctor and asking for a letter from your doctor. It is an approved form that needs to be reviewed. Which is, as set out in some of the material we're finding. That's exactly right.
So we've already heard, haven't we, already that, and Antony said there's been some action from government to close down some people that are acting in a way that is nowhere near in accordance with the public health order or the law, but we're hearing of fake IDs, and one of the questions we had come to us earlier was, I'm in good faith as a business owner, I've let somebody in who's fashioned a fake ID. What happens there? What happens at law there? What possibly can we do to address that?
Well, employers or occupiers or owners of premises, occupiers of premises, they have an obligation to act reasonably, and it's not their job to be at the door, you know, working out if it's a fake certificate or not. Mind you, we all know what the certificates look like. They're green, and if somebody comes in with something that clearly looks nothing like it, then I don't think that letting them in on that basis would be reasonable. But if it's a fairly good forgery, you know, the occupier of the premises will not have liability there because they've acted reasonably in the circumstances.
But I mean, when you do look at the various proofs of vaccination and medical exemption, there are a number of ways in which it is presented. So we do have to, as controllers of premises and owners of small businesses, we have to make ourselves and our staff familiar with that. So probably some training is what some of your clients are probably looking to do as well, as you've mentioned.
Yes, absolutely. I think that's a huge part of it. I absolutely agree. And it's training around, as you say, identifying what the obligations are around entry. But it's also what we touched on last week as well. It's also being able to push back and have training on dealing with customers where we might see that the evidence are showing us is not good enough or not required, that how they might deal with the conflict situation as well. So it's providing that training too.
So Antony, some of the material that's been provided in the signage, clearly that's been a very thorough process. So the evidence and the examples that are put there can be really closely checked as a way of people being made very clear about what can and can't be accepted.
Absolutely, and like I said, these things are being updated as well. So, I mean, if in doubt, businesses can very quickly check the web page, federal site, and see what are the points or the areas that they should be very often, this is something that they can actually use to train their staff as well, to keep a lookout for these kind of things, which might, even stop people from accessing that information or trying to access the premises using that.
Okay, we've got a question that we did have come up earlier. We've moved to this section, which we'll ask Christie to talk on, and then others may have a view or some helpful insight. But do the public health orders override the privacy laws? And we know that with the dissenting commissioner at Fair Work quoting some material around privacy and other literature, that came up. But your thoughts on that from a legal perspective?
Certainly, Steve. So from a legal perspective, some of the public health orders, particularly those that relate to aged care and to the nurses, they give the employers the power to ask for records. So that is something, and if an employee is not prepared to do that, then they're in breach of the public health order. In relation to other employees, look, I mean, you can ask the question, I mean, clients have sort of said to me, can I ask for someone's vaccination status? I said, look, you can ask the question. They don't necessarily have to answer it because they do have a right to privacy. So it's really about having that conversation. It's about, number one, assessing whether you really need to store that information, whether you need to store that vaccination information or whether you just can simply cite it. So they're very different factors to consider, because if you're just looking at it, it's a lot different to actually storing it and it potentially being subject to some sort of cyber fraud and somebody getting your personal information. So what I would be saying recommending to clients and to all businesses is that they, number one, establish whether they really do need to retain those records. They have established privacy policy and that they make sure that they're acting in accordance with that privacy policy. But at the end of the day, if particularly occupiers of premises of these high-risk activities, if the people coming onto their site, particularly visitors, are not prepared to show evidence of vaccination, then they can't let them in. It's as simple as that. The business does not have the power to demand to see it.
Yes.
The police do.
Yes, that was an interesting insight that I read.
So the police do. So
people have a right to refuse to show their vaccination status.
That's right.
But they don't have a right to entry, and if it becomes a situation that's unmanageable, then
the police should be
you can
contacted.
call the police.
That's exactly right.
Yep.
Okay. Steve, the other thing I might just add to that is the information that you actually gather is not the name, and you don't need to actually store it. Especially from a business, you just cite that vaccination, and that's it. You're not actually writing it down anywhere like previously before they had the QR code check-in. You don't actually record anything down. In terms of employees, all they may want to do, if they think they need to record something, once you cite it, there's just a number. There's a number. That's all they got to do. It's not a name, not details, no age, nothing.
Yes,
so there's a lot of things that's not been actually recorded from a privacy perspective.
Now, one of the things we asked the panel right at the beginning was to think beyond this, and we had a small conversation at the beginning as well about, particularly for employees and vaccination status and the possible likelihood of booster shots.
Yes.
And do you want to talk on that from a HR perspective, because you had an interesting insight on that?
Yeah, and I guess it's just something we've got to see yet. We don't know, but in relation to storing private information from an employee, if it is that we will be required to have, for example, a booster on the anniversary of our vaccination, then it's being able to ensure, so if we're not recording employee information, it's being able to, I guess, ensure that booster shots are happening when required, and where the line is in relation to the employer's obligation under work health and safety. Because if employees down the track are a little bit ambivalent or a bit ad hoc about getting the booster, and as time goes by, then arguably our ability to manage work health and safety and protections within the workplace might slip. So I guess there'll be some questions around how do we ensure that booster shots are happening in the workplace,
so like you
and
said,
where the responsibility starts
it'll
and
become
finishes.
part of recruitment. It might become part of an annual declaration along with licences. And
that's right. We were talking about that. So is it the same as driver's licences? Is it the same as, licences to operate machinery? Is it the same as a working with children check?
Exactly.
Yeah.
Does it become...
It might even become part of the certification on the app like after a certain amount of time, if you don't get the third vaccination, who knows? Maybe that's something that,
Yes.
it might just flag, change to a different color or something.
Yes. Yes.
Yeah, that's right. So I guess
Smart.
they're the things that we need to still navigate. Yeah.
Yes.
We've got a few questions now, which we'll turn to as well, and I know that we'll give each of you a chance to sum up, or if there's some things that have come up that you'd like to address towards the end. But one of the questions we've got here is it correct that you can have one dose and have a second one booked by November 30?
I thought it was earlier than that.
I thought it was.
It might
I
be
thought
a
it was
little
the
bit earlier
first.
than that. Will you go to your notes
I think it's the
there?
1st.
1 November.
The
I'm pretty
1st
sure.
of November.
1st of November. So it is correct that, no, it's not correct that you have one dose and the second one booked by November 30. It's November 1.
And that's just for those that are outside of the Greater Sydney area. Their premises are outside, they reside outside of Greater Sydney, they've had one dose of COVID, they're allowed on premises for the purposes of work. After the 1st of November, they will no longer be allowed on the premises for the purposes of, on any of those high-risk premises for the purposes of work if they haven't received
Their second
their
dose.
second
Okay,
dose.
here's another dynamic in that area that I'll add in
Yes.
as well, and it's already happening, where we've got people bringing in contractors to do, say, work, industrial cleaning, whatever, and they're coming from Sydney and they're now coming to Newcastle. And now we've got people from Newcastle, potentially, going to Sydney to do work. What reasons can people have to be able to travel to or from or to Greater Sydney?
I don't think that they should be travelling at all.
I think it's
my
no
understanding
exemptions?
my understanding was all of those, and Antony may know more. I thought all of those border restrictions and passes had pretty well ended.
It is
right on that?
basically from Sydney as such, and it is one city, not
Yes.
tale of two cities as they called it. So within that area you can travel. I mean, if you're in the metro area or the as classified, not regional. So if you're regional, then it's an issue. I mean, you've got to justify, do the application and do all kinds of things before you can actually travel.
Yep.
Right.
Okay.
That's my understanding.
So people need to be aware of that and be alert to that.
Yes.
Okay, so the other question here, which kind of we've covered early, but we'll revisit, is can my un-vaxxed employee work for me in an adjoining LGA? I guess that's depending where that's coming from.
That's right. So
Yeah.
if it's in regional New South Wales, that's
Yes.
fine. But Greater Sydney, I think it's important to note that Greater Sydney does extend to the Central Coast.
Yes, it does.
And I think it
Blue
also comes
Mountains.
to the amendment as well, where the Chief Health Officer will publish on New South Wales Health website if there are any
Stay at home.
lockdowns.
That's right.
Yes.
So people need to be aware of that, and particularly if they've got a business where they have staff moving around as part of that business, or they themselves move around, they need to be conscious of that obligation to be aware of what they can and can't do with regards to movement.
That's right, Steve. The public health order does have a part that does provide for sort of, I guess, quick lockdowns.
Yes.
At this stage, there aren't any places that are in lockdown, but there are rules and procedures set out in the event that happens. So it has been provided for in this current health order, and if it does happen, then we'll all have to go to the health order and get the information.
And I
about
guess
that.
two observations there. We've already seen some fines applying to businesses, haven't we, whereby they have not met the public health order requirements and have people on site or operate their business in a way where they have people on site. So what have you observed from that?
Yeah, I think there are some instances of some hotels, and I think there was a hairdressers as well. So both of those are in this high risk,
that's right.
sort of what we would regard as the high risk industry. If those people are there for the purposes of work and they have received one vaccination, they are allowed to be on the premises, but they are not allowed to be on those premises without at least one vaccination.
And the fine, $55,000, and then could be up to $27,500 a day thereafter, somewhere around there.
I'm not sure what the fines
don't
are.
care.
I think they're different for individuals versus businesses.
Yes.
I know that.
Businesses.
Maybe Antony might
Antony,
know a
you
bit
got
more
a
about the
sense of that?
fines. Yes.
Not really the actual figures, but yes, there's a difference for the business, and it's
Yes.
pretty high. And like I had a customer who rang today because one of the employees did not want to get vaccinated, and I said, the risk is not worth it, just for one employee. Make sure that you kind of abide by the rules, stick to the rules, check the rules, make sure if there's any changes, and don't, second guess, because the fines are pretty steep. And also, it is not only the fines, your business can be also shut down for cleaning and all those kind of things.
That's
Which
right.
leads me to where I was going next. So if we do have a transmission event, then we're still going to be subject to this, scrutiny of a of a hygienic clean that is COVID safe
That's
with all
right.
the PPE and all the costs.
deep clean.
And then, Antony, I'm not sure if you know or others on the panel know, then you are then subject to an evaluation that has been done, that the site is free of the virus or risk, and therefore there could be impact on your business in a practical way, that it's not able to trade, and on a reputational way
That's right.
thereafter.
That's right.
Absolutely.
Yes.
Yeah, that's the most important thing as well,
is.
especially in businesses that are just recovering. You know, and I think there's a couple of days, more than 7 days, I think, we got to be shut down, deep cleansing and all those kind of things. The risk is too high, you know, for what it is.
And some of the fines have been related to certainly to allowing employees come on that have not been vaccinated, but also, you know, clients and customers allowing them on, and not just not having their due diligence in place, and just being, you know, too lackadaisic about it. So it's really critical.
Well, that's right. The obligation is to act reasonably.
Absolutely.
And that is taking some action.
So we're heading to a wrap. Any concluding comments, observations, insights that you'd like to share on concluding before we close for the webcast?
I can jump in, Steve, if you don't mind, because
Please.
some information has been released in terms of support that's going to be made available for businesses. One of them is the fee and rebates charges that have been extended, which has gone up from $1,500 to $2,000 now, and that also can be used for businesses that fall under the category and qualify to use it for tolls. Then you have the summer holiday stock guarantee that's coming out as well. If an area, like as we spoke before, for any reason gets shut down and perishables they lose all those things, they can make available of some of the grants that are coming through. And also for the charitable and non-profit organizations, there are some help coming through. So please visit Service New South Wales page. All the information is there, and also I'm sharing this information with councils and other agencies so that they can share it with their members as well.
Good point, and I notice we should probably keep an eye on that as our new Premier is recalibrating the recovery and making announcements on a fairly regular basis. So very important that we keep an eye on some of those changes and opportunities for support. Looks like we've got one last question coming in before I close. I've just got our able assistant here writing extremely quickly from that onto the whiteboard. Employees that have not been vaxxed will not discuss and can't work from home. Can they work face-to-face after December 1st? Well, that's at the discretion of the employer.
That's right. So we haven't really touched a lot on vaccinations tonight, but I guess a takeaway for me is just to remind businesses that those obviously, they still have the responsibility to provide a safe working environment for their employees, and we're looking at risk minimisation. And whether you're a high-risk business or just fall under the general order, you still need to be thinking about whether a vaccination policy is appropriate for your business, and if so, you need to be thinking about communicating that to your workforce and also to your visitors and your clients on the premises. So I guess the takeaway for me is just to remind clients that, to remind business owners, is that it is your business, and if you want to bring in some of these rules, then get advice about whether it is appropriate in those circumstances. So after December 1, there are plenty of businesses, you know, BHP I think was one of the big ones that announced it last week, that they will still be having mandatory vaccination policies into next year. So as of the 1st of December, certainly businesses that you know, have mandatory vaccination policies will continue to do those, especially if the transmission rates we're seeing are still high, and you know, we just don't know at the moment. So I guess there is scope after the 1st of December for businesses who want to bring in vaccination policies, who are reasonable about doing that, and undertake all of the consultation requirements and make sure that it's right for their workplace, for them to continue to do that post 1 December. So I guess to answer the question, employees that have not been vaxxed will not discuss and can't work from home. Can they work face-to-face after 1 December? Well, that's up to you as the business owner. So it's right. It's not a case of all the new signage that we got comes down. No. It comes back to our original premise, which is we don't want a transmission event because of the damage to our business's reputation and capacity to operate. That's right. And it's not going to be suitable. A mandatory vaccination is not going to be suitable for all businesses, but it will be suitable for quite a lot. Yes,
I agree. I also think, if I can add on to that, I think it's what we're seeing with our clients as well is that employees are happy at the fact that the vast majority of the workforce is vaccinated. You know that
it's minimising risk.
It's minimising risk, and I think we're finding, and it's indicative of our high rates of vaccination as well, where over 90% have had their first dose, right?
That's right.
The state. So I think it's a real indication of people's willingness and want to be vaccinated and feel safe in the workplace. But an extension of that as well, I know we've talked a lot about the laws and public health orders and what legally we should and shouldn't do. I think it's really important as we transition back to work and as we head into territory we've never headed in before, that leadership and culture in an organisation is really critical. So how we transition our employees back and how we communicate and how we guide that process. And that's around setting safety standards and communicating. Some people might be more reluctant than others to come back, and it's about having those conversations and allowing them a little bit of breathing room, right?
It's good management.
It is just really good leadership and management, and having a balanced approach I think is going to be really critical. Because what we're hearing as well is that when the dust settles on this, you know, there's a lot of experts in the industry that are saying that we're going to see a big push with people wanting to leave their employment and go elsewhere. So there will be a big
retention and recruitment.
A big retention issue. So how we manage this as leaders and as employers is going to be critical to retain your good staff, because people will leave, and they're already saying that when the dust settles that we will start to see quite a larger turnover of staff.
Thank you. I think it's really interesting when you do raise that, and we look to the roadmap and we just review what the conditions are that we'll operate our businesses under. So density limits of 1 person to 2 square metres indoor and outdoor areas applies to most activities listed below. So we still have a density limit expectation.
Yes.
Masks will be required only for public transport, planes, airports, indoor front of house staff, hospitality.
That's right.
Masks no longer required in outdoor settings, including for front of house staff, and proof of vaccination no longer required by public health order.
By public health order.
So it does change, but it doesn't change your position in your business about how you're managing your risk. That's up to you.
That's right.
Yeah.
And I mean, everybody has their particular moral views on what's right and what's wrong, and I'm not discarding those views at all. People are entitled to have views. Our job is about risk minimisation and looking after a business and advising businesses to do what is the less risky thing for them to do.
Okay, any other wrapping comments, concluding comments? Antony, Christie, Di, we good?
Like I said before, please keep checking our webpage, and that will always gather the latest information. If in doubt, please reach out and we'll guide you through the right channels.
Okay, well, it's time for me to wrap the webcast. So firstly, I would like to thank Christie, Di and Antony. If you want to contact any of our guests, please email the Business Centre and we'll forward on your details. We'd like to again recommend the Business Connect program, which is dedicated from the New South Wales Government to deliver a network of independent service providers to help you start, grow or adapt your business. If you want a session with the Business Connect program subsidised by the New South Wales Government under Business Connect, call 1300 134 359 or email connect@treasury.nsw.gov.au. All you need to do to access Business Connect is complete a registration. This typically takes you up to 8 hours of support in a financial year, including advice, live events such as this, workshops and other events. There is no cost for the first 4 hours of business advice. Businesses affected by COVID-19 can access a range of these services free of charge. We thank and acknowledge the support of the New South Wales Government's Business Connect program in funding the development and production of this webcast. And finally, thank you from me, Steve Waite, your host, and the best of luck with your continuing reopening of your business, and we'll see you next time. Thank you, everybody.